is Andrea, and I'm a student nurse.
I'm Christa, I'm a nurse here at the hospital.
Would you mind if I shadow you today?
I would love that.
Can you give me an SPAR report on your patient, please?
Of course. So our patient is Shanana O'Connor. She's in room 231. She's a 34-year-old female. She has one allergy to trimethoprim sulfamethoxylate, and she has full code, and the admit doctor was Engelbert. She's 177 pounds, 5'9", and her BMI is 26.1. So the main reason that she came in today was for a fever, but it's from an undetermined origin. Her secondary diagnosis is end-stage renal disease. She's a type 1 diabetic since age 8, and she's been diagnosed with end-stage renal disease 1 year ago, and she has a history of recurrent UTIs. So she does have a pain of 4, but denies any change in vision or hearing. And she reports numbness and tingling in her lower legs and mild diaphoresis. But she does have a functioning AV graft, and it's clean and intact with thrill and groove present. Her cap refill is less than 4 seconds, and she has a positive perla. Her sensations are diminished in her lower legs, though. She denies any shortness of breath, denies recent colds, reports quitting smoking 2 years ago, and all lobes of her lungs are clear to auscultation. She denies any chest pain or palpitations, and she reports elevated blood glucose over the past few days. The normal dose of insulin is not controlling her blood glucose well, so she is having elevated glucose readings, and she's tachycardic. S1 and S2 is present, and there's no murmur noted. She has 1+ non-pitting edema in the lower extremity and 1+ pedal pulse in both feet. She's on a renal disease diet, and she has a 1,500 milliliter fluid restriction. She reports weight gain of 10 pounds over a few months. She has a decreased appetite and a decreased intake, so that's a little weird. And she denies any abdominal pain, denies change in bowel habits, but her abdomen was soft, round, and non-tender, and her bowel sounds are times 4 quadrants. Her intake is 375 milliliters, and her output is 200, and she reports decreased frequency and volume of urination. And she says that it's darker and more concentrated, but she denies any pain, burning, or difficulty urinating, and there's no bladder distension. Some of her vital signs at 0730 were her respiratory rate was 20, her heart rate was 95, her temperature was 101.1, and her O2 sat is 96, and her blood pressure is 138/78. So her blood pressure is a little elevated. She does have a history of hypertension, and she does have an elevated temperature, which is why she actually came in here. And she does have an IV in the right median vein, peripheral, and that's where we'll be administering her some antibiotics today to help with that. And she had a urinalysis, and it showed cloudy amber urine, and she does have an increased white blood cell count at 15. So today we'll be administering her imipenem, cilastatin IV, and just a sodium chloride with that to be the primary.
Why specifically is this client receiving this medication?
Well, she has a fever of unknown origin. That's why she came in. So we believe she has an infection, and she also has a history of UTIs. So that it could be that. So we're just going to be giving her an anti-infective medication called imipenem cilastatin, and that's a broad spectrum antibiotic because we're not exactly sure what is causing the infection right now. We did have a urinalysis which shows that her white blood cells were at 15, which is high. But we haven't gotten her culture back, so we don't know specifically what it is, so that's why we're administering her a broad spectrum.
What action does this medication have on the body?
Imipenem binds to the bacterial cell wall, which will actually kill the cell, so it's bactericidal, and cilastatin with it prevents renal inactivation of the imipenem.
When should you question administering this medication?
Well, somebody who shouldn't receive this is if they have an allergy or hypersensitivity to cilastatin, imipenem, or cross-sensitivity to penicillin or cephalosporins, but she does have one allergy. It's to the trimethoprim sulfamethoxylate, and that is not related. So it's okay to give her that, You'll want to watch for patients who do have renal impairment. You'll just want to lower the dose for them. And yeah.
Does this medication have a therapeutic serum level?
It does not have therapeutic serum. We'll just monitor her white blood cell count and her fever to see if it is being therapeutic for her.
Which vital signs do you need to monitor?
You'll want to monitor all vital signs, but especially in this case, since she has a fever, we'll want to monitor her temperature and make sure it's getting into normal range. And you'll want to watch her blood glucose because that was high, elevated too. And also, since she has a history of hypertension, her blood pressure.
Which physiological parameters should be monitored when this medication is being administered?
You're going to want to monitor for signs of infection like wound appearance, but in this case, since she doesn't have a wound, we're going to just watch her temperature, watch her white blood cell count, and we'll just see, we'll ask her if her urine is getting less concentrated, because she's been saying how it's a dark, cloudy amber color, so we'll want to watch out for that. And you always want to monitor for signs of anaphylaxis with this medication. And just any new medications that you're giving to somebody, because they could have a bad reaction to it. So just look out for rash, pruritus, laryngeal edema, and wheezing.
What interventions must be taught to his client to ensure that the medication is administered safely in the hospital?
Well, you'll just want to follow all proper precautions. You'll want to set up the IV right. You'll want to check the expiration date. You'll want to wash your hands, wear gloves. Make sure there's no bubbles. Make sure it's the right medication. And we'll always want to make sure that the person, when they're taking it at home as well, knows to finish out their antibiotics and to not share it with anybody. So we'll want to do that and just make sure that they're looking at the IV site and in the hospital, that we look at the IV site to make sure it's not red, that there's no complications with the IV. And just if we're diluting it, we'll make sure that they can be compatible together.
What interventions must be taught for taking this medication safely at home?
It's the same thing, just make sure that they're aware of the flow rate and everything that they should be doing, and if there's somebody helping them, make sure that they're aware of it too.
What are the side effects and potential adverse reactions?
Some of the side effects of this medication are diarrhea, nausea, vomiting, and rash. And if you do experience diarrhea, we're going to tell the patient to contact their healthcare provider because they could have C. diff. Even a couple weeks after you administer this medication, they still could have C. diff from it. So, because it's a broad spectrum antibiotic, so it's killing all your good flora along with the bad stuff. So, we'll want to watch out for that.
How will you know if this medication is effective?
We'll know if the signs of infection are diminished, like the fever, the white blood cells, and such.
Thanks.
You're welcome. Is that all your questions?
That's all.
Okay. So now we're going to open up the chart. So it's Janana O'Connor. So Shannon O'Connor, 34, and as we said earlier, she does have one allergy to the trimethoprim sulfamethoxazole. Okay, so we're going to go in and wash our hands. Hello, I'm Christa. I'm going to be your nurse today.
Nice to meet you.
How are you doing?
I'm doing well.
So I see that you're having a fever today.
Mm-hmm.
So we're going to be giving you some antibiotics for that.
Okay.
Okay? Have you had IVs before?
Yes.
Okay, great. So no complications?
Nope.
Okay, great. So just going to look at your armband. Could you tell me your name and your age, please?
It's Shanana O'Connor, age 34.
Okay. And do you have any allergies?
Yeah, to trimethoprim sulfamethoxazole.
Okay. Thank you. So now we're going to look in the chart. Let me see. So, Shannon O'Connor, age 34, and the one allergy is, as I said, trimethoprim sulfamethoxazole. Okay. So now we're going to check, we're going to go into the MAR, and we're going to compare the order to the MAR. Okay, so today we're going to be giving imipenem cilistatin IV. So we're going to be checking, we're going to make sure that it is the right person. Shanana O'Connor. We're going to make sure that it is the right medication, imipenem, cilastatin, the right dose, which is 500 milligrams, 100 milliliters over 1 hour, and the right time. And right now it is 7:36, and it's due at 06:30, so we're a little late on that. But so we compared that, and we'll also compare the sodium chloride while we're in the order. So you have sodium chloride as a medication for Shanana O'Connor, and the dose is 30 milliliters over an hour, and this is a continuous. We'll make sure the time is right, 7:37, and 06:30 is the time, and the route for both of these is intravenous. The imipenem will be piggyback. Okay, so now we're going to go ahead and get our sodium chloride. I'm going to check it here, do our first check. Okay, so you have sodium chloride, 0.9%, and it is 30 milliliters over an hour for Shanana O'Connor, and the time is 7:38. Due at 06:30, and the route is intravenous. Okay, so we did our first check on that, so now we can go ahead and I'm going to put my gloves on. Before going on, I'm going to just, for both of these, I'm going to check the expiration date. It's 3/25, so we're good. This one is also 3/25 for the antibiotic. So just make sure of that, and that there's no leaks, and it's clear, like it's supposed to be. Okay, good. And you can just check now. Just before, I did check before with the pharmacist to make sure that they can be mixed. But let me go ahead and look. Sodium chloride and imipenem cilastatin. If you see here, it does say that they can be mixed, and it's appropriate for the situation. Okay? So now go ahead and hang this up. Before I do that, I'm just going to make sure that the IV site is patent. I'm going to wipe this. My flush. So wipe this off. 15 seconds. That. You feel any pain?
No.
Okay, great. So I'll just cap that. Okay, so now I'm gonna just make sure that my dial flow is working as well. Let me take this, and this is in a brand new package, so it's sterile. Go ahead and flush this. Okay. your checks. Just gonna check it. This time I'll actually just input it in here. Get my green light. Would you mind reading me your patient ID?
Sure.
Beep. Okay. What's your patient ID?
It's 842 33 43 660.
Okay. Okay. And Jayla, would you mind showing? I'll come to you actually. Show the green light. Okay, so now that we have a green light, we'll just do our third check on this. So we have sodium chloride for Shanana O'Connor. It's the right route, intravenous, 30 milliliters per hour, and the time is right. It's 7:43, and it was due at 6:30. So we're a little late. It's okay. All right, so that was it. Sure I locked it. Prime it. Make sure there's no air bubbles. Okay. Connect it here. Okay, let's, before we start, just check our flow rate one more time. Is 30 milliliters over an hour. And Andrew, would you want to check that with me?
Sure.
Let's set it to 30.
Is that 30?
Okay, great. So I will let that run. Okay. Now we're going to set up your antibiotic, okay, Shanana?
Okay.
Alrighty. Let's grab that out. Okay, so we have the right person, Shanana O'Connor, the right medication, imipenem, and it's IV, the right dose, 500 milligrams, and the right time. 06:30 is when it's due, and right now it's 7:47. Okay. So we'll go ahead and just scan it in. So that'll count as our second check, scanning it in there. Okay, could you read me your patient ID, please?
Sure. It's 842 33 43 660.
Thank you. Beep. And I scanned that one too. I just had to manually enter it because our machine's down today. Okay, so we have the green light there. Sure. Okay. So we're checking it and it's not expired. Okay. So now, let me just put it here. I'm going to check it one more time. That's cabbage. That's okay. Actually, take it off of here. Okay. So, we have Shannon O'Connor, imipenem and cystatin is the drug. 500 milligrams is what we're administering. It's intravenous and on the time. Again, we're a little late. It's 7:51. It's due at 06:30. Okay. So check all that. Now prime the tube. Do you mind holding that over?
Sure.
I'll just document that one. Then we'll do some teaching. Go ahead and grab the pamphlet that I have. Hi, so how's everything going?
It's going well.
Are you having any pain?
No.
Okay. And before I did check the IV site before I gave it, so there wasn't any redness, there wasn't any swelling or anything. Okay, so some teaching I want to give you. Do you know any side effects that could happen from this medication?
I think one might be a rash. What are some others?
Well, the major one you're going to want to look out for is diarrhea. If you're having that, even if it's a couple weeks after you've gotten the antibiotic, you could have C. diff, so you want to contact your healthcare provider if you do have diarrhea.
Okay.
Because it is a broad spectrum antibiotic, so because they're good flora, along with the bad stuff that could be causing your infection. And if you're on any birth control, it could make it ineffective, the antibiotic. So make sure that if you are, you want to make sure that you're using other options for birth control.
I'll be careful of that.
Yeah. And if you're going out in the sun, make sure you're wearing sunscreen. So that, because it makes you more prone to burning. And so what are some of the side effects? What would you think? Well, actually, I can tell you. The nausea, vomiting, and diarrhea would be the major one.
Yeah, I think you said diarrhea.
And what would be like the major, what would that be causing?
Oh, well, C, it could be a C. diff.
Yeah.
C, so.
And just make sure that you're not sharing your medication and you're following your treatment as prescribed. Is there any other questions you have?
I don't think so. No.
Okay. Well, I have a pamphlet just on how the antibiotic works and just all the stuff that we talked about.
Awesome.
So, here you go.
Thank you.
And I'll be back to check on you in about 30 minutes, but this will run for about an hour.
Okay.
And I will document my teaching after. Did you have any questions?
Yes, actually. Were there any pertinent pieces of information that you reviewed before administering the client their medication?
Yeah. Well, first you're going to want to check the lab work. Because we did see that the white blood cells were 15, so they were high. Saw that she had a fever. So there was obviously an infection, so we want to monitor those, especially the temperature and the urine. And we always would check to see if they have an allergy to the medication or if there could be a cross-sensitivity, but there wasn't in this case.
Did this information affect your decision to administer the medication?
Yeah, it did, because since she is having an infection, I deemed that it would be therapeutic to administer the medication, and it would probably help, since it is a broad spectrum, until we get the culture back to see like what we could rule out and try to get it more specific.
Did this information affect how you administered medication?
It didn't affect how I administered it. It's just like the same with every IV administration. You're going to want to make sure everything's clean and just follow proper precautions.
All right, thanks.
You're welcome. Do you want to watch me document?
Yeah, that'd be great.
All right, great.